hope that everyone can see these clearly. And I noticed that Oliver Bullock, who was on our project team, has also joined the call, so that's fantastic. So the research team is well represented, which is great to see. So thank you very much for having me. So I am also a senior consultant with Affinity Health at Work, and an occupational psychologist, and I'm in the final year of studying for my doctorate in organisational psychology at Birkbeck, and Dr. Kevin Teoh is my supervisor, so very nice to be working together on this presentation and project. So to start, I would like to share just a bit of the background to the project that we're presenting today. So the Thrive at Work project is looking at thriving in private practice for dentists and doctors. And in today's presentation, we'll be looking at doctors in private practice. And I think we're scheduled to come back sometime next year or in the next round of Lunch and Learns to talk about our findings with dentists, as they're quite separate and different. The project was funded by the MPS Foundation, so part of the Medical Protection Society. The MPS Foundation is a not-for-profit research initiative dedicated to improving patient safety, reducing risk and enhancing well-being of healthcare professionals. And it was led by Professor Joe Yarker at Affinity Health at Work, in partnership with Dr. Kevin Teoh and Professor Gail Kinman, both at Birkbeck, and Nikki Cordell at Cordell Health. And we were also supported throughout our research project by a steering group, which was made up of medical and dental professionals from different specialisms in different countries globally, to keep us on track and support us when we were defining the different parts of our project. So why was this research needed? I think we're all aware that there's high levels of burnout reported in doctors and in the medical profession, and also that a growing and significant proportion of doctors are working across the public and the private sector. In the UK especially, the doctors are working across the NHS and private practice very often, so 66% of the doctor population, but in other countries as well. So in Australia, it's nearly half of all medical professionals that work across private and public practice. The American Medical Association report that 27% of turnover in 2022 was burnout related, leading to huge costs. And the British Medical Association is reporting very, very similar figures, with a very clear negative impact on well-being, and with that also on patient outcomes and financial performance. Now, what we found when we were kind of formulating this research project is that there is very limited research in private practice. The kind of working conditions of private practitioners or practitioners working across two different sectors may well impact their psychosocial risk factors, or the risk factors to their well-being at work and their working conditions. And there is very limited research available, very limited data available, and even quite hard to define what exactly kind of private practice conditions are in different countries. So there's a real need to understand the working conditions of private practitioners more, with that move that we're seeing to private practice. So that is the reason that we applied for the funding and why we started this research project at the beginning of 2024. So we know from our research at Affinity Health at Work and the wider research that psychosocial factors have the potential to cause harm to people in the workplace, and that exposure to excessive work demands, or a lack of control within work, or a lack of support can lead to negative outcomes for individuals and also to a wider organisation. And this is both in terms of well-being, mental health, but also physical health consequences like musculoskeletal consequences or cardiovascular health, fatigue, migraines, and organizational implications. So research increasingly looks at the role of those workplace characteristics in terms of the extent to which it impacts on well-being or on burnout specifically. And we understand quite a lot about the different risk factors in different organizational settings, and there has been quite some research looking at the kind of antecedents to doctors' burnout. I know that Dr. Kevin Teoh, you've done research extensively into burnout within doctors, but much less is known about what these kind of psychosocial factors look like in private practice. So this was our kind of starting point and framework and knowledge when we started looking at this project. So what were the aims that we set out and the questions that we set out to answer with this research? So the overall aim of the Thrive at Work project is to look at how can we better protect and promote the personal and professional well-being of clinicians in private practice, with obviously one of our sub-questions, and to what extent is that different for medical doctors and for dentists. And some of our key research questions that we formulated were: what are the work-related risks experienced by medical professionals working in private practice? What are some of the similarities and differences in risk that are impacted by the specialism of the doctor, the level of private practice and public practice dual role, and the impact of geographical location, both in terms of country, and we were also interested in looking at rural versus urban settings. We also wanted to understand more around the relationships between work-related risks and the medical professional's mental health, and in turn the self-reported or perceived outcomes for patients. And finally, we wanted to kind of understand and put that all together in terms of what is the relevance and the salience of those different work-related risks that we identified. So I will tell you a little bit more about the different stages that we went through in that research project. So we formulated these research questions end of 2023 and started the kind of distinct pieces of work for this project throughout 2024. And first of all, we started by doing a systematic literature review to really have an understanding of what is out there, what knowledge do we have, what applies to private practitioners, before we moved on to conducting some semi-structured interviews. So we spoke to 15 doctors in private practice in different countries around the world. And once we built that understanding with the literature and the interviews, we designed a survey. And Kevin will talk a little bit more about our survey findings later on in the presentation. And then towards the end of last year, we analysed and started synthesising those findings all together with the view to disseminate the results through a variety of different platforms. So we're in the process of producing academic papers for journals. We have the opportunity to speak in different places, so very great to be here today. We are also presenting our findings at the Society for Occupational Medicine conference later this month, I think, or early next month. And the Medical Protection Society is also supporting the dissemination as widely as possible of these findings. So to talk you through the different components of our research and what did we find. So my colleague Hannah Carline went through a very thorough review process to conduct our systematic literature review for this study. And the kind of key question we were looking at was, what is the relationship between perceived working conditions, mental health, and perceived patient care for doctors working in private practice? With one of our sub-questions or additional interests, is there any evidence out there looking at doctors working in a dual role capacity, so both in public sector and in private healthcare setting? So we started off with 277 titles and went through a thorough process of screening. So firstly, screening all the titles, then all the abstracts, and then the full articles, to make sure that we only included those that were truly answering our research questions and our inclusion criteria. So ended up with 14 papers in our final literature review. And we are on the verge of being able to submit our first version for a journal review. So I'm hoping that over the next few months, this research article will be ready for publication. So what were our findings in terms of the literature? So looking across the papers, we saw that all the research could be classified into demands and resources according to the job demands resources model, which was designed by Bakker and Demaruti. And you're probably very familiar with this model, but for those who are not, maybe just to very briefly explain that job demands are those physical, psychological, social, or organizational aspects of a job that require sustained kind of physical and psychological effort. So they are seen as the kind of psychological or psychosocial costs of a job that need to be balanced out, but with the resources available to an employee. So what we found was that 8 studies in our literature review were reporting on job demands, including emotional demands, mental demands, kind of inter-role conflict for those medical professionals working across different roles at the same time, workload, competition with others as a threat to find a feeling of financial security, and elements around violence at work and work-life integration or work-life balance. 8 studies also looked at job resources, and job resources were examples that were described were around control over your work and the timing of your work, or the scheduling of work, the social support available through colleague relationships or wider social support, the degree of freedom at work, quality of leadership, as well as benefits and rewards within private practice. And we found 12 studies that measured well-being outcomes in the form of burnout. So that out of the 14 studies, that was the kind of key well-being outcome measure that was being reported on. So some of our key conclusions, having reviewed and screened all these different research evidence papers, is that we didn't find any research into the dual public and private role, despite its growing prevalence. What we did find was that private practice settings were associated with higher demands at work, more cases of malpractice, and lower levels of leadership and feedback. And this is something that we also then continued the conversation around in our interviews, especially around the availability of leadership or line management within private practice. Practitioners in private practice also reported a better work-life balance due to a larger feeling of control and reward over their work. So after we finished the literature review, we had a really good kind of foundation and evidence-based for the next phase of our project, which was to talk to medical professionals and we spoke to 15 different doctors in 7 countries. And we had some very interesting themes come out of our conversation. So we had kind of semi-structured interviews, so we knew some of the questions that we wanted to ask, but we were also able to be open to what came up in the conversation. And they were hour-long conversation over Teams. And some of the key themes that the people we spoke to mentioned were around workload, and especially working hours or antisocial working hours. They also spoke about task switching as part of the workload, and the difficulty in taking breaks. And this was partly because of time pressure, but some of the doctors I spoke to also spoke about the kind of design of their workplace, and sometimes the guilt they would feel if they would go for a lunch break, but had to walk past the waiting room, for example, where their patients were waiting. And many doctors also spoke about the high amount of admin work. Control was another theme that came up, and this was people spoke about the lack of control over their workload, sometimes the lack of control over the type of patient they would see and the treatment options that would be available for them to offer within the context of their private practice. And some of the change management that they experienced that was difficult to manage if there was a kind of continuous sense of change. But people spoke about an increased feeling of overall control in private practice as a positive, as one of the kind of resources available to them. Then people spoke a bit about patient relationships and about the high expectations that they sometimes felt they faced within the private practice group of patients, that could make it hard to manage their boundaries, and also the impact of the mental health of some of the patients that they saw. And on the other hand, they spoke about the kind of energy they got from the positive relationships they had with their patients. So the relationship really had that kind of dual role that could be a cause of tension or pressure, but could also really be the cause of their passion and reason to be in the profession. And people spoke about finances, and specifically in terms of private practice, the kind of increased earning potential, but on the other hand, also the increased administration that comes with kind of insurance relationships and claims, and the pressure of the kind of revenue making that would lead to kind of increased workload. Some of the other themes that came up that were interesting across the different conversations were around the fear experienced around litigation or the possibility of litigation, the lack of mental health support that some private practitioners experienced, as well as stigma to talk about their own mental health or the pressure that they were experiencing. So in conclusion, we kind of clustered some of our themes together, that people experienced a high workload, a lack of breaks, a high admin load, but at the same time felt that they had an increased sense of control over how they organized their time and their work. That on the positive, there's the higher earning potential, but in terms of pressure, there's a higher pressure to be profitable, to work with the insurance admin and to balance patient care as well as high expectations. And that one of the concerning things that was raised was around stigma experienced around talking about your mental health, and a lack of available mental health support within the private practice. So I'll hand over to Kevin to share a little bit about our findings from the survey. I don't think we can hear you, Kevin, or I can't.
Hello, what about now?
Yeah, perfect.
All right. Right. So, as I will say, thank you, Marleen, first of all. And much of the survey results complement what Marleen is talking about in terms of the review, but also the interview data that's come out over here. So we had the surveys that went out globally, and we looked at a number of different predictor variables in terms of measuring of aspects of the working environment. So demands, so things like workload, like financial pressure, financial stress, things like resources such as support from colleagues, from managers, control, work-life balance, and then a number of outcomes. So things like moral injury, patient care, work-life balance, and so forth. Broadly speaking, the results map upon what we would think from a theoretical perspective. So that's encouraging because we've not seen a lot of work done with this specific occupational group. But that means that burnout is typically predicted by demand. So in this case, workload, we didn't find any relationship with resources. And on the other hand, when it comes to work engagement, that this is then predicted by resources such as support and control. And that, I guess, starts to open up conversations around if we want to mitigate and we want to manage burnout, then actually what we should be looking is recognizing the impact that demands such as workload have, and maybe not focus so much at individual level or resource level aspects of the environment. Other relationships that are worth pointing out, so patient care, so we got doctors to self-rate the quality of care that they were providing. This was associated with a sense of moral injury, and then that sense of work-life balance, unsurprisingly predicted by workload and also control. And again, that ties into some of the points around the importance of control that Marleen covered in relation to the interviews. I think one of the interesting things, particularly on the key conclusions over here, is the relationship between working hours in private practice and that relationship with doctors' perceived working conditions. So actually what we observed was the more that doctors worked in private practice, the poorer they reported their working conditions. So in a way that might challenge some of the assumptions sometimes that people think that working in private practice, maybe it's not always as rosy as one might think. And when asked about access to resources, just under 40% said that access to health and well-being resources, and just over 20% acknowledged utilizing them. And what that essentially suggests is that doctors are looking at these resources more in terms of reactive support rather than being preventative. And when we look at the relationships that things like workload and control and support have, that actually there should be a conversation about having more preventative support available too. Because what we see when we look at the patterns of relationships that are evident over here is that oh, I don't know. I've moved to the next slide, Marnie. Does that move for everyone?
Have you got the support slide? Is that the one you wanted?
Yep. Yes.
Yeah. Great.
Okay. So, yep. So what we see over here is that with the relationships where organizational support is offered, we generally find encouraging patterns of relationships. So doctors typically report lower levels of demands, increased levels of resources, lower levels of burnout, better self-reported patient care, and better work-life balance over here. And you see that obviously in the table in front of you. Perhaps what was surprising in terms of patterns of relationships that we didn't see, Marleen alluded to the financial pressure coming out of the interviews. We did measure financial stress, but that wasn't really associated with the outcomes that we looked at, and that may perhaps be whether that's something specific to our sample or whether it's the way that we measured that. That's something for us to reflect upon moving forward. And I guess one of the main things also is that fundamentally doctors in private practice who report greater supervisor manager support had higher intention to access support in time of needs, because what we see is not just the availability of support, but whether they would access it if they actually needed it. So I think it again lends back to the point around stigma, and having a conducive or supportive environment is more likely to facilitate individuals engaging with support where that is made available. In a way, that's an overview of the quantitative data. I think there's some calls to action if we reflect then on the project overall. And I'm going to hand back to Marleen over here.
Thank you very much for sharing that, and always good with a survey to kind of be able to reach a wider audience. So where we were only able to speak to 15 doctors in the survey, we were able to survey I think it was 528 people. So just to give us that kind of broader input into some of our assumptions and challenge them in some cases. So in terms of calls to action, so given the number of doctors moving into private practice and working already in private practice or in dual roles, there is a real need to understand the impact that has on their working conditions, on their kind of choices and their daily life, in a way, that the balance in their life, and for us to understand better why people choose to work across private and public settings, and exactly what that means. So while we were going through the different stages of the research, we realized that it would be incredibly helpful if we had common definitions of what private practice means, and also if we had more researchers reporting on the numbers of doctors in private practice or in dual roles, the types of specialisms of those doctors, so that it would be easier for us to compare evidence across the board, and start supporting doctors in private practice better with a better evidence base. The evidence base then in the area of well-being in terms of psychosocial risks, but also in terms of the absenteeism in private practitioners and their supported return to work, if they are supported to return to work, is something that we are very keen to continue having a spotlight on and building an evidence base for. The other area is around intervention. So there's very little research and evidence base on tailored interventions within private practice that are effective, that are found to be effective to improve health and well-being, and to reduce the impact of work demands within those settings. So that is another area that we feel there needs to be continued focus and continued research. And then finally, with the aim to be able to promote and support well-being in doctors in private practice, we need to have that evidence base and also provide support, provide more tailored support, and provide knowledge that support is available, so that people feel more able to find the support they need and use it in time of need, which, as we found in the survey findings that Kevin just described, was quite low, people's kind of ability to take up support when needed. So that is our kind of overview of calls to action. And with that, that's the end of our whistle-stop tour of this project. So thank you so much for listening, and we'd be very happy to answer questions where we can. If there are any questions or any feedback or discussion, very welcome too. I'll stop sharing the slides so that we can see each other.